Is your case like BC's? A young married woman who has been trying to conceive for over a year? She finally felt, "This is my month. I've gotten everything right this time. It's not going to pass me by." Then suddenly, she noticed spots of blood around the time of her usual menstruation, and her hopes of getting pregnant that month were shattered. What BC didn't know was that she was actually pregnant, and that blood wasn't her usual menstruation as she assumed. It was something called implantation bleeding. Or is your case like Anita's, a young, sexually active student who does everything she can to prevent an unwanted pregnancy? Every month, Anita waits with her heart pounding in fear until she sees her period. Only then does she feel assured that she is not pregnant. And then, just like every other month, around the same time, she begins to bleed slightly. She heaves a deep sigh of relief and says, "Thank God I'm not pregnant." What Anita didn't know was that this wasn't her usual menstruation. It was actually implantation bleeding, and she was already almost 2 weeks into her first trimester. Now these brings the questions, what is implantation bleeding? Why do women confuse it with menstruation? And how can we tell the difference between implantation bleeding and regular monthly menstruation? What is implantation bleeding? Implantation bleeding is light spotting, or bleeding that occurs when a fertilized egg attaches to the lining of the uterus. This happens about 6 to 12 days after ovulation and is an early sign of pregnancy. It occurs because small blood vessels in the uterine lining may break as the embryo burrows in. Why do young women confuse it with menstruation? Many young women mistake implantation bleeding for their period because 1. Timing overlaps. It happens around the time their next period is due. 2. Mild bleeding. Some women have naturally lighter periods, making it hard to differentiate. 3. Lack of awareness. Many are unaware of implantation bleeding and assume any vaginal bleeding is menstruation. 4. Irregular cycles. Those with irregular cycles may not recognize the difference. Key differences between implantation bleeding and menstruation. The major differences between implantation bleeding and a regular monthly period are color, flow, duration, clots, cramping, and timing. Color. While implantation bleeding is light pink or brown, periods are usually bright or dark red. Flow. Implantation bleeding is just light spotting, whereas periods involve moderate to heavy bleeding. Duration. Implantation bleeding lasts a few hours to 2 days, while periods usually last between 3 to 7 days. Clots. There are no blood clots during implantation bleeding, whereas periods may have blood clots. Cramping. Implantation bleeding may cause mild or no cramping, but periods usually involve mild to strong cramping. Timing. Implantation bleeding typically occurs 6 to 12 days after ovulation, while periods follow the regular menstrual cycle. If someone is unsure whether it's implantation bleeding or their period, taking a pregnancy test after a missed period can help confirm. Take note, not all women experience implantation bleeding when they get pregnant.